Hi everyone, this is my first time joining DataFest, and I'm going to share my screen now. Since there are not many representatives from Asia, especially from Southeast Asia, I guess it would be good for me to share some of the covering of COVID-19, the pandemic in Southeast Asia. So before that, just to make it clear that this is not a map of Southeast Asia. Southeast Asia is part of Asia. And this is Southeast Asia plus other neighboring countries like China, Korea, Japan, India, right? And to make it clear as well, Southeast Asia, a lot of outsiders tend to see it as a homogeneous region, right? We always refer it to, for example, East Asia, for example, Southeast Asia, right? But actually in Southeast Asia is very, very different, in terms of culture, religious, languages is different, economic development is different, even political systems are very different in this region. So there's no way for me to categorize or to stereotype Southeast Asia, as a homogeneous, single region. So just bear in mind that, today what I am going to share you with are some cases, different cases and situations in different countries in Southeast Asia. I am not trying to represent a whole region because that is simply not possible. Right, by the way, you can download the slide from the link at your left bottom corner. I will also share the link in the Slack channel so that you can get the slides, and then there are links to all the stories that I'm going to share. A little bit about my initiative in Malaysia. I have a kind of small company called DataN, and what we are trying to do is to provide training, consultancy to newsrooms, especially in this region, Asia, Southeast Asia, to help them to create, data journalism with limited resources, meaning for medium media organizations here. So we do training, we also do advocacy for open data, data visualizations, data storytelling. We also collaborate with different newsrooms and journalists, to create their data stories and projects. So in Southeast Asia, right, being a journalist here and trying to report on the COVID-19 is like Tom Cruise in the movie of Mission Impossible. You're trying to stay alive, and while you're trying to accomplish your reporting missions, right? Because not just the pandemic, you're also facing other challenges in this region. For example, in the Philippines, right, early this month, the ABS-CBN broadcaster in Philippines, which is Philippines' largest entertainment and media broadcast network, it was forced to terminate all its broadcast channels, radio channels, TV stations, because the Filipino government refused to renew its broadcasting permit. Because the president of Philippines, Duterte, he never liked ABS-CBN because the network has been very critical of his administrations. And before that, even before this, he has made several threats to try to shut down the broadcasters. And this time he did it, he really did it. So until today, the broadcasters is still not able to broadcast any news through their radio or TV stations. They can only publish their content online. And let's go to another country, my country, Malaysia. Just before the pandemic reached its peak, a group of lawmakers in Malaysia, they staged a political coup, leading to the collapse of the federal government. This happened in early March, right? And so there was no political leadership. There was not even a health minister for about 2 weeks during the pandemic. And after that, the racist and the corrupted political parties, that have been rejected 2 years ago, they came back to power, and without going through any election. And they are now the new government trying to handle this pandemic, this health crisis. And they are not friendly to media. They are not they are not strong supporters of media freedom in Malaysia. So journalists in this region, right, Malaysia and the Philippines are just two examples. We are not just, trying to struggle with all the issues and problems while reporting on the pandemic. We are also fighting other front lines, right? Political oppressions, infrastructures problems, things like that. However, the journalists here, we continue to publish good reports and try our best to inform the public as well as the policymakers, on the pandemic. So I'm going to show some of the stories. This is a investigative stories from the Philippines. This is done by the Philippine Center for Investigative Journalism. I'm going to switch it to the stories so you can see the live stories here. In Southeast Asia, you will observe that we don't do a lot of beautifully designed or fancy graphics. A lot of it is still presented in text. So this story is actually looking, the journalists are trying to look at, why the usual emergency response that we use in other crises is no longer applicable in this pandemic, because in Philippines, especially in the city of Manila, there are actually a lot of areas with high level of poverty, and it's overcrowding. The population density is very high. So, and the people there, they don't have access to basic health and social access. So in those areas, if you apply a lockdown, it's not going to work. And social distancing is not going to work as well. So this story actually mapped out all the areas that are more vulnerable in the city, and to look at how those areas have access to, for example, hospitals. The blue dots here are hospitals, and the red dots are the cases of known COVID-19 cases in those areas. So a lot of people have to violate the quarantine rules, right, to travel out of their neighborhoods because they need food, and they need access to basic medical services, things like that. So they also look at the areas where there are all these we call it settlements. Actually, those are slums area where the poor people live, and they live in sometimes very cramped living conditions, and there's no way for them to practice any social distancing. Right. The other story is the one I want to highlight is from Malaysia. It is done by Malaysia Kini, an online website in Malaysia, which is also currently the #1 enemy, in terms of media for the new government, right? Because they have been very critical of the government for many, many years. But still, they're able to produce a very well-designed and beautifully designed dashboard that might be, so far, I think it's like the best dashboard that I have seen in Southeast Asia. And you can see like the charts here, the usual charts, right, we see in dashboard, right? And you're able to dive into each, for example, each different state in a country. And not just in the state, you will be able to look at the district level data. Not just that, you'll be able to go into locality. Locality is the administrative level that is lower than district, right? So in all these different locality, so they are the only website in Malaysia that are able to break down, all this data in such a detailed ways. And how do they do that, right? You look at this, you might think that, oh, this is pretty, this is beautiful. But there are a lot of works, a lot of efforts behind the presentation, because in Malaysia, the Ministry of Health, they announced the daily updates. They provide the daily updates of the COVID-19 cases, through a infographic, like this. This is a static image. You don't have access to the data directly. There's no API. There's not even a spreadsheet for you. Basically, it's an infographic that is updated every day, and there's a press release in PDF format. So can you imagine that the journalists, they have to come in every day, they have to wait for this press release to arrive, and they'll have to manually find the numbers, copy and paste it into their own system. They have to do this every day for, since March until now. It's almost, it's already 2 months, right? And this is only the data for the national level data. For the district level data and the state level data, they have to go to the different Facebook pages of different administrative and different government agencies, and again to extract the data from there, right? Copy paste, copy paste. So it's a lot of copy paste, and you can't even automate it because this press release, every day the format is different. Every day, sometimes they will start with telling you the recovered cases. Sometimes they start by telling you, the other data. So there's no way for you to write a program and go in and to pull out all this data automatically. So there are a lot of human work behind the dashboard like this. And this dashboard has been proven to be very, very popular. It already received, I think, a few dozen millions of page views so far. And in some countries, right, not all the media organizations, they have the ability and the capacity to produce their own dashboard, to show the latest situation of the pandemic. So in Indonesia, there's a group of journalists, they call themselves Journal Coders Indonesia. So what they did was that they did several not infographic, but interactive database. For example, this is one of them, an Indonesian map showing the number of confirmed cases in different provinces. And they make it free for all the media organizations to embed the data visualization in their own websites. Because in Indonesia, again, there are many local publications, small one that is serving a province, or they're just serving the people in a small districts, in a small city, and they just don't have the capacity, the developing, the website development capacity or the data capacity to be able to update this kind of data visualization every day. So this is a effort by the journalists who are also coders. They're able to pull in data from the government, and they update the data visualization every day and make it free for other media organizations to embed it. So talking about getting data, right? The access of data is one challenge. The other challenge is the data quality. This is a table published by the University of the Philippines. What they did is that they're trying to track the data quality, the consistencies, of the COVID-19 data released by the government. And you can see from this table, for example, the demographics of the patients, right? Age, sex, residence, nationality. They publish it, like for 3 days in a row, and they stop publishing on this day. And they continue for another 3 days, and they stop again this day, right? So even these data, what types of data, the details of the data are not consistent. Not just this, they also found that, there are a lot of problematic data, because so they compare the data released by the government on the April of 24th and April of 25th. And you can see that, there are cases where the patient's gender have been changed, age have been changed. So if you're using the data on the April 24th for your analysis, you would have to update your analysis the next day because the data is different. And this issue is still ongoing until today. And so these are some of the biggest challenges that we face, when we are dealing with data from the government. So for some journalists, when there's no good, reliable data from the government, they are trying to be creative. So how do they do that? For example, this story is done by the Reuters correspondent in Jakarta. Right. So as we know, in Indonesia, the number of testing is very low. So there are a lot of COVID-19 deaths that were not detected. And because of that, it is very hard to accurately estimate, what is the death toll caused by the pandemic. So in this case, the Reuters correspondent in Jakarta, they're trying to look for other indirect measurement of the death, possible death caused by COVID-19. And in Jakarta or in Indonesia, right, you don't even get like a monthly update of number of deaths in the country. They only release you, every year. You only get the number of deaths for 2020, at the end of 2020 or maybe early next year, right? You don't get the number. So they are trying to find if there are other sources of numbers. And what they found is that the Jakarta departments of parks and cemeteries, they actually publish a monthly update of how many funerals happening in the city. So this is not totally accurate, right? Because if a death occurred and there was no funeral, or the funeral was done outside of the city, then that funeral would not be recorded in the database, right? But that is the best data you can get, if you want to estimate how many deaths are in the city. And this data is only for the city of Jakarta, because in other cities, you don't have this kind of data as well. So they get the data and they do a comparison with previous historical data. And what they found is that, in the month of March and April, you can see a huge surge in the number of deaths. The number of funerals. Again, this funeral is not the numbers of deaths, these funerals. And the earliest data they can get is from 2018. Before that, there was no data. Okay, so this is the best they can do, and they found that this number of deaths, or we'll call the excess death, right? The number that is higher than the average, right? Is much more. The number is much higher than the official tally of the death caused by COVID-19. So, which means they probably would have more death due to COVID-19 than what have been recorded by the government, because a lot of victims were not tested before they were buried. So this story has this approach has also, after this stories was published, this approach has also been used by the economists as well as New York Times to try to estimate the deaths caused by COVID-19 in many other countries. So I know that the economists have recently they have made their data public, I think a few days ago, that all the number of deaths they are collected from different countries, and they compare to historical average and trying and compare with the official death number announced by the government to see whether there's a gap between the number of deaths and the number of deaths announced by the government related to COVID-19. The other story that I think is very creative, in using data when there's no reliable data. It's another story by Reuters. Reuters used the data of Grab. Grab is a e-hailing service that is very popular in Southeast Asia. So the good thing is that because they have been collecting data in all the different cities in Southeast Asia, so it is able for us to compare with different cities, because it is all collected by the same company, and you just have to deal with one company to get all the data. So using the data, they are able to visualize the traffic conditions before and after the lockdown to see what is the effect of the lockdown. So this one shows you Manila. Manila is known to be very, very jammed, very, very congested, the traffic. One of the most congested cities in Southeast Asia, right? And this is after the lockdown. Right, so they use the surveillance CCTV, the surveillance cameras, to show you the traffic and the data. Again, before and after. This is in Ho Chi Minh City in Vietnam. So using data from technology company is actually a new trend in Southeast Asia, because this region, we have one of the highest adoption rate in terms of using mobile technology to do everything, to do our daily stuff. So the technology companies that provide the services actually collect a lot of data about people's life. Sometimes they have much more better data than the government. And more journalists have started to turn into the technology companies to get this kind of data to help with their reporting. And I think my time is almost up. So that's the stories that I would like to share with you. So thank you very much for having me.